My name is Hugo Lavigueur-Blouin from University of Montreal, and I would like to thank BJUI for the interest in publishing our editorial. As many already know, a significant proportion of aging men will suffer from bothersome lower urinary tract symptoms. Recent trials have been conducted in order to compare newer alpha blocker agents. In a recent study, Novara and authors reported on the efficacy and safety of Silodosin in a pooled analysis of individual patient data from 3 registrational randomized controlled trials comparing Silodosin and placebo in patients with lower urinary tract symptoms. This article contributed pertinent information to aid the clinician in the selection of an alpha blocker that is best suited for a specific patient suffering from LUTS. In this study, patients were subdivided into groups in order to analyze differences according to baseline patient characteristics. In regards to efficacy, Silodosin was significantly more effective than placebo in improving IPSS total score from baseline to study end, regardless of patient's age. When comparing the efficacy of Silodosin in different age groups, patients 65 years old and younger had a slightly higher Qmax improvement. Interestingly, in patients with concomitant use of antihypertensive drugs, the use of Silodosin was not associated with a high risk of either dizziness or orthostatic hypotension compared to patients who were not taking antihypertensive drugs. The current study brings further evidence that Silodosin is a safe alternative from a cardiovascular standpoint. From a sexual standpoint, patients in the Silodosin group had significantly more adverse events as compared to the placebo group. Retrograde ejaculation was by far the most common side effect, affecting 32.8% of patients less than 65 years of age, versus 0.9% in the placebo group. Similarly, in a study by Chappell and colleagues, as many as 14.2% of patients in the Silodosin treatment group suffered from ejaculatory dysfunction, compared to 2.1% and 1.1% of subjects in the tamsulosin and placebo treatment groups respectively. When comparing the safety of Silodosin in patients younger and older than 65 years of age, the overall adverse event rate, ejaculatory dysfunction, discontinuation rate, and discontinuation rate due to adverse events were all higher in younger patients. Although the percentage of subjects who discontinued treatment due to adverse event was small, one might hypothesize that over a longer follow-up period, such a prevalent side effect could be responsible for a higher discontinuation rate. Consequently, it should be kept in mind that for patients desiring to maintain antegrade ejaculation, especially younger patients, Silodosin might not be the best treatment option. Furthermore, it should be recognized that some patients would potentially accept a reduction in treatment efficacy in order to preserve ejaculation. In conclusion, careful consideration should be given to specific patient characteristics such as age, comorbidities, and personal preference towards sexual function when offering the patient an alpha blocker. Thank you for your time and interest in our editorial.